Welcome to part 1 of nursing practice questions and answers about labor and birth. Now let's start with the first question. The nurse is caring for a client in labor. Which assessment findings indicate to the nurse that the client is beginning the second stage of labor? So select all that apply. So these are the options. Option A, the contractions are regular. Option B, the membranes have ruptured. Option C, the cervix is dilated completely. Option D, the client begins to expel clear vaginal fluid. Option E, the Ferguson reflex is initiated from perineal pressure. So for this question, the correct answer is option C, the cervix is dilated completely, and option E, the Ferguson reflex is initiated from perineal pressure. Now let's move to the rationale. The second stage of labor begins when the cervix is dilated completely and ends with birth of the neonate. The client has a strong urge to push in stage 2 when the Ferguson reflex is activated. Finally, options A, B, and D are not specific assessment findings of the second stage of labor and occur in stage 1. Now let's move to the second question. The nurse in the labor room is caring for a client in the active stage of the first phase of labor. The nurse is assessing the fetal patterns and note a late deceleration on the monitor strip. What is the most appropriate nursing action? So these are the options. Option A, administer oxygen via face mask. Option B, place the client in a supine position. Option C, increase the rate of oxytocin intravenous infusion. Option D, document the findings and continue to monitor the fetal patterns. Now for this question, the correct answer is option A, administer oxygen via face mask. Now let's move to the rationale. Late decelerations are due to uteroplacental insufficient and occur because of decreased blood flow and oxygen to the fetus during the uterine contractions. Hypoxemia results, so oxygen at 8 to 10 liters per minute via face mask is necessary. The supine position is avoided because it decreases uterine blood flow to the fetus. The client needs to be turned onto the side to displace pressure of the gravid uterus on the inferior vena cava. An intravenous oxytocin infusion is discontinued when a late deceleration is noted. The oxytocin will cause further hypoxemia because of increased uteroplacental insufficient resulting from stimulation of contractions by this medication. Finally, although the nurse will document the occurrence, option D will delay necessary treatment. In my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.